All right, here is our cyberanatomy lab video for the larynx, the last one. Yay! Here we go. This should be something like what you are currently seeing when you look into the back of the pharynx. Since you've opened this up in the midline when we did the bisection, you should be able to see the epiglottis, the posterior tongue, this sort of thing from this view. This is our context, just in case you're wondering. But the only thing that's going to be different about this view is that all of this is going to be covered in mucosa at the beginning of your lab, and so you won't see these muscles or these cartilages won't be as obvious. But that's all right. Like, I think you can imagine what that would look like with mucosa on it. The way we're going to proceed through this dissection is that probably the very first thing you should do is identify the cartilages of the larynx. Get these things identified right away by palpation. Some of them you can see, some of you can feel. The thyroid cartilage is quite big. It's this huge shield that is on both sides, but it's open in the posterior. If I turn it around to this side and get rid of some of this business, you can see that this is the thyroid cartilage from the front. Here's the laryngeal prominence in front. This is, we've been in this neighborhood before because we did all these strap muscles months ago. So this shouldn't be totally new to you. The cricoid cartilage is the thyroid cartilage sits atop it and is joined at an actual joint. The cricoid cartilage is quite tall in the posterior, but it's quite short in the anterior. So keep that in mind, that the cricoid has these sort of larger in the back, smaller in the front shape. And then the arytenoid cartilages are some of the more interesting ones. These are, I'm not sure how this is going to come to us here. Let's see here. Let's go one forward. There we go. So here's the arytenoid cartilages. This is a sort of unusual shape. You'll definitely be able to feel this within the mucosa. If you just grab that edge and sort of squeeze, you'll feel what feels like a very small tooth inside of the mucosa. So give it a feel, but refer to the models for the specific anatomy of the arytenoid cartilages. There's a vocal process that projects anteriorly and a muscular process that projects laterally. These will be discussed in lecture in great deal. But the vocal process, at least for basic understanding purposes, the vocal process has the vocal ligament attached to it, and it runs from the vocal process of the arytenoid cartilage to the inner surface of the thyroid cartilage. So those are going to be the cartilages that will manipulate your voice. If you can move the arytenoid cartilage or the thyroid cartilage, then you can change the quality or the sound of your voice. Okay, so that's the basic elements of the cartilages. Let's next start processing the different muscles. And the first thing you'll want to do is just focus on this region and remove the mucosa from this area to reveal the muscles that you see here. The first set of muscles that you see in the posterior are the very obvious posterior cricoarytenoid. There's one on each side, so together they have this sort of heart-shaped look. And the muscles that go from one arytenoid cartilage to the other, these are the transverse arytenoids, and then the oblique arytenoids, they have the same basic pattern, but they just cross each other, so they just have a different shape. The posterior cricoarytenoids go from the cricoid up to the arytenoid cartilage, specifically that muscular process. Remember, the part that goes lateral is what this muscle attaches to. Then the next place we're going to go is we're going to look right around the corner. If you go up the posterior cricoarytenoid to the muscular process and then go back down around the lateral, you're going to see the lateral cricoarytenoid. Again, attachment on the cricoid, attachment on the arytenoid, but it's on the lateral side, so that's its name. These two muscles are antagonists. If this muscle contracts, this is going to make the arytenoid cartilage rotate so that the muscular process turns inward and the vocal process comes outward, which is going to abduct the vocal cords and allow you to take a deep breath. On the other hand, the lateral cricoarytenoid is going to pull the muscular process laterally, which is going to rotate the arytenoid cartilage so that the vocal process swings medially. And these, if both of these do this, then you actually approximate your vocal cords. You get them close enough to each other that you can actually generate a vibration between them, which is the sound of your voice. So this is the muscle that allows you to take a breath. This is the muscle that allows you to make sound by approximating the cords. Now, you probably won't be able to, let's see, where are we going next? Yeah, we're good. So you probably won't be able to see the cricothyroid direct, or the lateral cricoarytenoid directly. I'm going to show you a step in a minute how you can get to that better. This is very small muscle, but also on this lateral side, just superior to it, is another muscle called thyroarytenoid, and this is running from the arytenoid cartilage up to the thyroid cartilage, and you can see it from two views. You can see it from the inside of the larynx, just adjacent to the vocal ligaments, but you can also see it probably more easily initially on the lateral aspect of the larynx, running from the arytenoid to the thyroid cartilage. So this is the step that you're going to need to do in order to expose those really easily. I'm not sure if you saw that very well, but this cartilage was originally joined to the cricoid cartilage. There's actually a joint here. It's shown on this side. But you're actually just going to take your scissor and just snip that off so that you can sort of pry that open, which will give you really good access to see into the lateral side more easily. And these muscles, again, very small, but they are distinct, and you can often see the space between them and try and differentiate the superior muscle, the thyroarytenoid, and the inferior, the lateral cricoarytenoid. Okay, the last muscle we're going to look for is the cricothyroid. This muscle runs from the cricothyroid or the cricoid anteriorly to the thyroid cartilage kind of laterally. This is the antagonist to the thyroarytenoid. The way these two muscles work, I guess it's easier to think about the thyroarytenoid first. So this muscle, the thyroarytenoid, since it goes from the arytenoid cartilage to the thyroid cartilage, if this muscle contracts, it's going to pull the arytenoid cartilage forward, which is going to relieve the tension on this vocal cord, which is going to create a looser chord or a lower pitch to the voice. So by contracting this muscle, we relieve tension on the cord, which decreases the pitch. On the other hand, this muscle, the cricothyroid, the way this muscle is going to work is it's actually going to tilt the thyroid cartilage forward, because this joint right here allows movement on a rotational axis. So when this muscle contracts, it pulls the thyroid cartilage forward and down, so it sort of tips forward. And when that happens, that indirectly then pulls on the vocal ligament and increases the tension on the vocal cord. So by increasing the tension, cricothyroid elevates the pitch of the voice. So those are just the basic, the muscles that we're going to find, the basic functions associated with them. Again, we're going to do these in lecture and demonstrate these in a variety of ways. There are good models for these as well, so use all the resources at your disposal to understand these muscles. All right. The next aspect of the dissection is that we're actually going to go into the larynx, and we're going to open it up and look at the vocal folds. And this is, trying to get a sense for that view when you look through the laryngoscope down into the larynx. If you look down in here, there's actually two folds that are covered in mucosa. The vestibular fold is the upper fold, the vocal fold is the lower one. And the vocal ligament that we saw before is in the vocal fold. That vocal fold, if you peel off the mucosa from here, you will find the vocal ligament. Now the way we're going to get to this is not by just looking down and picking at it. We're actually going to take a scissor and just cut straight through this whole larynx back here so that you can pull the whole thing open in the midline. And then you'll be able to like really widely open the vocal cords, and you can examine one of the vocal ligaments, remove the mucosa to find the vocal ligament. The other structure that you're going to find in there is, well, the thyroarytenoid muscle. That constitutes the majority of the vocal fold. But these thinnest fibers of the thyroarytenoid that are directly adjacent to the vocal ligament. Now these actually touch the vocal ligament. These are called vocalis, and these are involved in more of the subtle adjustments of the vocal ligament to get sort of optimal vibration during phonation. The last step of your dissection is going to be to remove mucosa from the lateral aspects of the pharynx. This would be the laryngopharynx in this area. This space would be piriform recess alongside here. So you're going to want to remove all of that mucosa to find the internal laryngeal nerve, which is coming in through the thyrohyoid membrane. This was a branch that we found the start of last week off of the vagus nerve. And then you'll also want to look inferiorly and try and find the recurrent laryngeal nerve as it makes its way into the larynx from below. You may have sort of accidentally found this nerve when you disarticulated the cricothyroid joint, because that nerve almost always runs directly posterior to it. So that wraps up the larynx lab, and that is officially your last dissection for gross anatomy. So congratulations, you've made it this far.